Signs your heart may be weak. In this video, I'll talk to you about signs and symptoms of heart failure. What are the warning signs? When should you worry? What can you do to prevent it? How to guard against heart failure? What causes it? Why does it happen? So I'm going to talk about heart failure, also known as a weak heart, in a straightforward, simple language that everyone can understand. I'll start with the symptom. How should you suspect that your heart may be weak? Number 1, fatigue. For instance, you used to walk 2 blocks and now, after walking 1, you already feel tired. You used to climb up 4 flights of stairs. Now after 2, you're already tired. Changes in breath. This could be a sign of heart failure. Decreased physical fitness or endurance, as some call it. You find it harder to perform physical activity. You don't necessarily feel short of breath doing household chores, for example. But a decrease in your fitness level could be an indication of heart failure. It's crucial that you notice this before it goes to the extreme of having shortness of breath at rest. For instance, when you're just standing still. So note this, it's very important. Reduction in physical fitness, decreased endurance, however you want to call it. Symptom 2, swelling. Also, a very distinctive sign. Why? Because the heart can't pump blood efficiently. This can lead to swelling. This swelling in the legs, or what we call in medical lingo, lower extremity edema, has a distinctive characteristic. It gets worse as the day goes on. If it's better in the morning and worse by night because of gravity, fluids tend to accumulate in the legs and feet more easily. If you've got heart failure, this could be a noticeable sign. If you press your ankle or foot area, there could be a mark. We call this mark a pit. So, if that shoe isn't fitting anymore, it's getting tight. This could also be a sign of swelling. Number 3, weight gain. We've discussed how fluid can accumulate. I mentioned in the legs, but not just in the legs. It could also occur in the belly, known as ascites, or even in the lungs with pulmonary edema. This can cause a weight gain. Although some people report reduced appetite, I do want you to note any change in weight due to fluid retention. Number 4, cough. A dry cough or a cough with a bit of froth or a pinkish liquid is also a characteristic of heart failure. When this kind of cough shows up, you have to check if it's not because of your heart, like if it's weak or something. Number 5, shortness of breath. Here I'm going to point out a specific thing about this shortness of breath. It's shortness of breath when you lie down. It's a common thing in heart failure when patients start to sleep with more pillows to breathe easier. So it's shortness of breath while lying down. It's different from the tiredness I mentioned when doing physical activities. Here, you can have shortness of breath when you're just lying down. Number 6, waking up to pee because during the day, you've got fluids collecting in your legs, for example. And when you lie down, your kidneys start to work more since they have to filter out all those fluids. So, if you're waking up to pee more than before, that could also be a sign your heart might be weak. There are other causes like diabetes and even some issues with the kidneys that can cause this symptom, but you should always check if it's not because of your heart. So if you're waking up to pee, it could also be a sign of heart failure. Number 7, mental confusion and memory changes. This sign usually only shows up when your heart function is already more compromised. So it's a sign of a more advanced disease. Same with the signal number 8, which is low blood pressure, also called low pressure, and even fainting or other signs like kidney failure. So the 7th and 8th, generally speaking, happen during a more advanced stage. Number 9, palpitations. If you're feeling like your heart's in your throat or like it's skipping beats, some people also say that, but that feeling that your heart's beating really fast or irregularly. Palpitations can also be a sign of heart failure. Number 10, swollen neck veins. You've noticed that your veins are popping out a bit more. This can also be a symptom of heart failure. What should you be on the lookout for? What should you keep an eye on? What might be causing this? I'm going to tell you all about it. But before I do, if you haven't liked this video yet, let's aim for 10,000 likes. You've already seen that this content is helpful and important. Millions and millions of people around the world have heart failure, and many more will in the future. And they need this info. They need it so they can seek medical help in the early stages when the chances of them fully recovering or managing their condition are much stronger. Much better. What are the red flags to look out for? What do I want you to make note of to ask your doctor? Feeling tired, shortness of breath, no longer able to do your workouts like before. If you're struggling to breathe during the night, if you're piling up more pillows, these are warning signs. Swelling is definitely one to keep tabs on because it could mean your heart isn't pumping properly and you're retaining fluid. So, if you're swollen, make sure to check if your ticker isn't weak. So, we've covered the signs. Now what causes it? Why does heart failure happen? What should you really watch out for? First off, high blood pressure. This could lead to heart failure. It causes a lot of changes, and it's a risk factor for heart attack, which obviously ups your chances of heart failure. Keep a mental note of high blood pressure. Now, what's a normal blood pressure level? Generally, 120/80. And when is it considered high? when your reading comes up to 140/90. There are some cases where doctors might let it ride a little higher, but as a rule of thumb, these levels are the ones to remember. So look after your blood pressure, keep an eye on it, especially when you're chilling at home or when you're outside of a doctor's office or hospital, because sometimes your blood pressure only goes up when you're at the doctor's. Sometimes the person is even calm, but their blood pressure increases in these moments. So it's important to have control over your blood pressure. Does this happen to you? This has a name. It's called white coat hypertension. A lot of people think it's a joke and that it doesn't happen, but it totally does happen. If that's you, don't forget to share your story here. Number 2, diabetes. You should take care of your blood sugar levels because it's also a risk factor. So if you keep normal blood sugar levels, that'll also help protect your heart. And now you must be wondering what normal blood sugar levels are. If it's a fasting glucose test, up to 99 for those without diabetes. And for glycosylated hemoglobin, for people without diabetes, it's up to 5.6. 5.7 to 6.4 is pre-diabetes territory, and 6.5 is diabetes territory. 6.5 or higher. Remember, for a diabetes diagnosis, this test should be repeated at least twice or be combined with another test, like the fasting glucose test. Another risk factor, number 3, cholesterol and triglyceride imbalances. And here I want to stress that having a high level of good cholesterol, or HDL, actually helps protect your heart. So, as a rule of thumb, we want that HDL to be higher than 40. And bad cholesterol, or LDL, should also be controlled. But the target level for bad cholesterol, or LDL, varies from person to person. So, for some people, that level will be a bit higher, and for others, a bit lower. For example, a 30-year-old athlete who doesn't have diabetes, high blood pressure, never had a heart attack, and has normal test results. 130 LDL for them is a good value. On the other hand, someone who has had 2 heart attacks, has high blood pressure, and elevated blood sugar levels, that person is considered at very high risk, so the LDL target for them will be much lower. So as you can see, this varies from person to person, and it's important to individualize, but take care of your cholesterol and the good cholesterol as well. And also, take care of triglycerides. Generally speaking, we want levels to be below 150, which also helps protect your heart. Don't smoke. Don't go overboard with alcohol. 1 drink tops per day. Some people might argue if even 1 drink a day is harmful or not, according to the science. As long as you don't already have liver issues from alcohol, like fatty liver disease, 1 drink a day hasn't been shown to increase risk. In fact, it could even protect your heart from certain disease. But listen, don't get carried away here, okay? I'm talking about 1 drink if you don't have any other risk factors, anything else that would make it better for you to have no alcohol at all. Number 5, avoiding physical activity. So, make sure you exercise. It's been proven that if you keep moving, it's good for your heart, and it will keep away a lot of diseases. But how much? At least 150 minutes over the whole week. So 30 minutes a day for 5 days, or 50 minutes a day for 3 days. Don't try to cram these 150 minutes into a single day. Instead, spread out these 150 minutes into at least 3 days, or even more. This will help keep your heart healthy. What type of exercise should you do? Can you just walk? Sure. Can you walk on a treadmill? A bunch of people ask me, can you run or swim? Yes, absolutely. Do the exercise that you like the most and that you can continue to do. Otherwise, it's going to be really tough to stick to your plan. Some studies suggest not just 150, but just a little more, 250 minutes per week. If you can manage, it might be good for your heart health. Number 6, keep an eye on thyroid issues. Yes, hormonal imbalances. Both overactivity, hyperthyroidism, and underactivity, hypothyroidism, if left unchecked, can cause heart failure and weaken your heart. Number 7, watch your weight. It's really important to keep your weight in check because obesity is also linked to a higher risk of heart failure. There are also factors like family history, genetics, structural changes in the heart, like problems with the heart valves. I won't talk about these too much here since you can't change your genetics, for example. But the 7 things I mentioned, pay attention to those because you can change those, you can make those better and live healthier with a healthier heart and lower risk of heart failure. The most common test used to check heart health and diagnose heart failure is the echocardiogram, or in some regions it's called an echocardiography, but it's the same thing. On a scale of 0 to 10, how would you rate this video? If it's a 10, I'll make more videos like this. Also, tell me where you're watching from in the comments. What part of the world do you call home? Hi from Porto Alegre. Now, I've got 2 more videos for you. Did you notice? 2 risk factors. 1, diabetes. So, in this video, you'll find 12 tips to improve your blood sugar levels. Take care. See you next time. Bye.